In this video, I'm going to give you a deep dive into cognitive behavioral therapy, CBT. What is it? How does it work? How do I actually do it? All right, let's roll that intro and get started. So the first thing that's important to know about cognitive behavioral therapy, or CBT, is that there is no one single core unit cognitive behavioral therapy. Instead, it's a scientific movement that brings together the science of the mind, the heart, and the body, represented in a class of therapies that are called cognitive behavioral therapy, CBTs. And these CBTs are all about lessening suffering and encourage living. What does cognitive mean? Cognitive means your private behavior, the stuff that happens between your ears and behind your eyes. The things that you think, the judgments that you have, the things that you feel. Even if you have physical pain, sensations that happen inside your body, we would refer to all of that stuff as cognitive stuff, the private behavior that you have. And the behavioral component represents what you actually do with your body, how you act, how you respond, what you say, how you move your feet, or if you choose not to move your feet. And the therapy part, quite simply, is about therapeutically, right, in a healing way, bringing together the mind, the heart, and the body to do things that actually encourage living, that result in a clinically relevant improvement in behavior. There's traditional cognitive therapy, but even before cognitive therapy, or CT, there was an entire treatment program by Albert Ellis, who's actually really incredible, and you should check out some of his work, called Rational Emotive Behavioral Therapy, REBT. And in REBT, Al Ellis would do some really cool stuff, like where he would hear things that people would say that were really stuck. Like if I was to say to Al, like, you know, Al, I'm unlovable and I just can't be in a real relationship. He'd be like, you know, Tim, you sound like a big baby saying that. Like, you know, I want you to like pretend like you're a little baby crying with your hands to your eyes and go like, I'm unlovable and I can't get people to love me. Now, I know that that seems a bit crass and a little irreverent. Maybe Al was a stand-up comedian in his past life. But the idea here is getting people to interact with their thoughts in new ways. That's the cognitive part. The behavioral part is strictly focused on what do people do. Look, if you're depressed and you've been staying in bed most days, you're not at work, you're not engaging with your friends, you're not engaging with your families, your hobbies, let's actually schedule pleasurable activities. Let's get you doing what matters to you. And what we find is that we don't want to say that, you know, people just kind of fake it till they make it, but what you do actually impacts what you feel. Now, this kind of breaks a little bit of a traditional mold. You see, the traditional mold is this sort of triangle that looks at the different things that people do and think and feel. The traditional model is that your thoughts influence your feelings and that your feelings influence your behaviors. And in traditional cognitive therapy, we would try to challenge your thoughts, we would try to change them through cognitive restructuring in order to get you to think differently about the things that are going on for you. This might also sound similar to things like neuro-linguistic programming, NLP programs. There's a number of different ways that this premise around changing how you think about something to impact how you feel so that you'll do something different as a result of that. This is a pretty common thing in modern approaches to addressing human suffering. One of the unexpected advancements, though, in looking at how we think about things and how we feel about things is, as it turns out, it's really hard to actually change the way that people think. I also hear from some people, though, that they don't work for them and that they get actually more stuck. And this is confluent with a recent advancement in the scientific literature that shows that it's actually really hard to get people to not think about things anymore, that distraction doesn't work as well as acceptance. So there's these newer cognitive behavioral therapies that are more based on acceptance-based approaches, helping you to notice what you think and feel, and rather than trying to challenge or dispute it, trying to restructure the way that you think, instead just being open to that and learning how to engage in a life that's important to you, learning how to be flexible in the presence of it. This is why the whole fad of mindfulness has come about in psychology and all these new ways of learning how to relate to our thinking and our feeling rather than just trying to change it, escape it, or argue with it. The bottom line is this: cognitive behavioral therapies are evidence-based practices, so they're scientifically validated to actually show that these therapies have a positive effect. And what's even better about this is like CBTI, for example, so cognitive behavioral therapy for insomnia. It's a great treatment. I've used it in my practice. And what I actually find that's really helpful is I like to talk to people about how there's no adverse side effects to doing therapy. It's just going to cost you your time sitting across from me. And if you live in a place where you're paying for therapy, then, you know, the session for what you would pay for therapy. The other nice benefit behind this work, it actually challenges the client to take on a more active and assertive role in their lives. Rather than the therapist being the expert on the client's experience and doing cognitive behavioral therapy to them, I like this position of the therapist being on the journey with them in this accepting position and saying, look, I'm going to try and be your guide along the way and encourage you to look at the experiences that you have in different ways. And this opens us up to the most recent advancements in cognitive behavioral therapy, where we have things like compassion-focused therapy, teaching people how to have completely new relationships to their history and to the pain that shows up for them. The bottom line about cognitive behavioral therapy is that it's an evidence-based practice. It's scientifically demonstrated to work to help people with the difficulties that they have in their lives. And it works for a variety of different clinical presenting issues. If you're thinking about becoming a CBT practitioner yourself, perhaps you're a mental health professional or you're a therapist thinking like, hey, I wonder if CBT is right for me, I definitely recommend checking the description below for some training resources. And if you're a consumer, if you're a client who's thinking maybe cognitive behavioral therapy will be right for me, just know that all therapists are different in the way that they might deliver CBT. So for example, myself, I practice from that acceptance position. So I do something called ACT, acceptance and commitment therapy. And my approach is to encourage you to be more open to your experience. Don't be afraid to check the description below for some different books, shop around, see what works for you, and really ask yourself, how is it that I want to learn how to interact with the things that I think and feel differently? And don't forget to subscribe, because I'll give you tons of resources on this channel for how to actually interact with your thoughts in different ways using this science of the mind, the heart, and the body. Thank you so much. I hope you enjoyed this video. Definitely hit the like button to show your support and share it, because you never know who in your world could benefit from learning a little bit about cognitive behavioral therapy today. Thank you so much.